Hi everyone. Today our focus is on giving explanations. In this unit, we will be studying the following items: explaining a diagnosis to a patient, explaining treatment to a patient, and discussing treatment. Hopefully, by the end of this lesson, you will be able to take notes about a patient's symptoms, explain a diagnosis, give recommendations, or explain treatment to a patient. That's what we're going to study today. Let's get started. We have a short interview between the occupational therapist and the patient. Before we do this task, let's quickly go over the vocabulary. All of you are familiar with the word obsession. Obsession is a noun form. Also, we have other forms like obsessive about something. This is an adjective. For example, you can say, I am obsessive about cleaning. But here we use the word obsess as a verb. Look at the examples. A lot of young girls are obsessed by their weight. I think all women are obsessed with something, and it's due to the media. Distracted means anxious and unable to think clearly. For example, when you are having a telephone conversation, you are more likely to be distracted and let your attention wander. In other words, you can lose your concentration or you can lose your attention while listening. Interact means talking to each other. In other words, communication, communicate with the others. As in the examples, if people interact with each other, they talk to each other or work together, etc. Lucy interacts well with other children in the class. Concentrate on is a phrasal verb. For example, doctors should concentrate more on prevention than cure. Look at these examples. Turn off the TV so you can concentrate on your work. I tried to read a few pages, but I found it hard to concentrate. Worried or worried about. It is used as an adjective. We were really worried about him during the divorce. The family became increasingly worried about her safety. Injure is used as a verb. Look at the example. Dad injured his back lifting some heavy boxes. Or you can say, Dad injured himself lifting heavy boxes. Many elderly people injure themselves in their own homes, for example, by sleeping in the bath. So we can say injure myself, or she injures herself, he injures himself, something like that. Okay, here is the short interview. You are an occupational therapist, and the patient is a 7-year-old boy. You interview his mother about the symptoms. The first thing you're going to do is to complete a dialogue with the correct form of the words given before. Now you can check your answers. As we have a short dialogue between the therapist and the parent, now we can note the patient's complaints. Read the dialogue again and try to highlight the important words that might be used in your notes and put them into this box. For this patient, in your notes you can say distracted, lack of concentration, obsession, lack of interaction, and no pleasure. So you can use some keywords to take notes. Before we study the rest of the dialogue, let's focus on the useful language box. As you know, doctors make a diagnosis depending on the findings, but while they are doing that, they use some certain structures: certain, fairly certain, and uncertain. Certain means you are almost sure about it. Fairly certain means it's possible to happen. Uncertain means it's a weak possibility. For example, my complaint is a headache. The doctor can say, you must have a migraine, or you can't have a migraine. Both of these sentences express that the doctor is almost certain about his diagnosis. So, depending on the findings, the doctor can say, you must have a migraine, or maybe he doesn't have enough findings and he can say, you can't have a migraine. What if the doctor is fairly certain? Then he can say, it seems you have a migraine, or it's unlikely that you have a migraine. So both of these sentences mean that the doctor is fairly certain about his diagnosis. If the doctor says, you may or might have a migraine, or migraine is a possibility, then the doctor is uncertain about his diagnosis. Look at the first part of the box, uncertain. He has a pain in the chest and he is coughing. So you can say he may or he might have bronchitis, because we don't have enough findings. Look at the second box, fairly certain. He is coughing and it gets worse over time, and he has a serious chest pain. He always feels tired and weak. So as you see, we have more information or more findings in this sentence. So the doctor may be fairly certain. He can say he seems to have bronchitis, or it's likely that it is bronchitis. Look at the next box. It says certain. He is coughing up blood. He is losing weight because he lost his appetite. He has difficulty in breathing and he has a severe chest pain. As you see, we have a lot of findings, and that's why the doctor can say he must have lung cancer, or he can't have bronchitis. He must have cancer doesn't mean that he has cancer. It's a high possibility, but still it's a possibility. Just looking at the findings, the doctor might decide that he has lung cancer. After observing Harry Jones carefully over several days, you're going to explain your diagnosis to the patient. Read the dialogue first and then complete the case notes below. As you remember, in your case notes, you are not supposed to write full sentences. We use short forms or short expressions. Okay, now it's time to practice some expressions to make a diagnosis. The doctor thinks the patient has schizophrenia as a final diagnosis. Look at the following findings and use the following expressions to say he is schizophrenic considering information. Okay, let me give you an example. Look at the findings. In the first part of the findings, we have only one finding, and that is excessive use of alcohol and tobacco. Can we say he is schizophrenic because he is drinking alcohol or he is smoking tobacco? Of course not. That finding is not enough to say he is schizophrenic. So the doctor can say he can't be schizophrenic, or he is unlikely to be schizophrenic. Here are the possible answers. For the second box, no eye contacts, hear voices when alone, no social skills and aggressive, we have more findings here. So the doctor can say he may or might or could be schizophrenic. Schizophrenia is a possibility. Suicidal thoughts, depression, obsessive compulsive disorder, tend to injure himself. As you see, we have more serious findings, more serious symptoms. So the doctor can say he seems to have schizophrenia, or he seems to be schizophrenic. Also, he can say he is likely to be schizophrenic, or he is like to have schizophrenia. If you look at the last box, it says all the symptoms given above. That means we have lots of findings that the doctor is almost certain about his diagnosis, and he can say he must have schizophrenia or he must be schizophrenic. He must have schizophrenia doesn't mean that he is 100% schizophrenic, but a strong possibility considering the symptoms. Now let's talk about explaining treatment to patients. Here we have a text. You are a dietitian working with a doctor. The doctor gives explanations about the diagnosis to the patient in the following text. First read the text and then complete the case notes below. Here is the case note. As you remember, when you fill in the case note, you are not writing full sentences. Try to take notes only. When you finish, compare your answers with mine. Here are the alternative answers. Symptoms: overweight, feel thirsty all the time, pass urine so frequently, problem with eyes, itch rash. For treatment, you can write tablets to control high blood pressure, no insulin necessary. For recommendations, appointment with a dietitian, weight loss, healthy diet plan, and see optician and podiatrist. So that's what you are supposed to write here. Here is a useful language box for explaining treatment to patients. If you want to offer some options to your patient, you can use these expressions. Look at the first one. There are a couple of options we can use. The first option is to try tablets. The other option is counseling. So you can say there are a couple of options, there are a few options, there are a lot of options, whatever. Then you can list them. Like the first option is this and the second option is that, things like that. When you want to advise a course of action, you can use the following expressions. For example, sometime off the work might help, or drinking herbal tea might help, or stop eating junk food might help. If you want your patient to continue what he or she is doing, then you can say carry on doing something. For example, carry on drinking lots of fluids, or carry on doing sports, carry on eating vegetables, or carry on drinking at least 5 glasses of water a day, things like that. When you advise patients to avoid something, you can use the following expressions like cut down on, give up, cut out, you should try to avoid, etc. Here is the task. You are a dietitian. Using the clues given in the box, explain the treatment to the patient. Try to use offering options, advising a course of action, advising patients to avoid something, and warnings to make sentences. Okay, now let's move on to discussion treatment. We have a short paragraph about children with ADHD. First, study these words and then fill in the blanks with the words in the paragraph. Read this text carefully. You are a child development specialist and working with a pediatrician. You are discussing about a boy with the pediatrician. Look at the findings and complete the case notes below. Do not write full sentences at all. Try to write the keywords and change the form of the words if necessary while taking notes. Let me give you an example. In the text it says he can't pay attention to lessons. Then you can write unable to pay attention. Or in the text it says he lost his father. Then you can write loss of father 9 months ago. Now compare your answers.